Welcome to our series Researchers with a Passion. My name is Nerina Finetto and my guest today is...
I'm Meghnath Dhimal. I work in Nepal as an environmental health scientist since last 15 years, and I am also a member of Global Young Academy, and currently I am chairing the Global Health Group at Global Young Academy.
Thank you so much for joining me. What is your research and why did you go for it?
Basically, I was brought up in the rural Nepal, so I had a curiosity about how changing environment affects health of the pupils since my early childhood. So basically, my work is how this changing environment or the environmental factors affects human health and how we can prevent disease, infections, etc. from the environmental and social factors. So my research focus more on the environmental factors, social factors, cultural factors which are linked with the behavior of the peoples, because if you see the global burden of disease, more than 80% disease are attributed by the environmental risk factors. And basically, especially in the developing country where I come from, like if you see the disease like diarrhea, cholera, like the respiratory illness, these are the common now. And the major risk factor for this is the environmental risk factors. Like most of the developing country, people still use the solid biomass fuel, which is the major cause of respiratory illness like pneumonia or ARI, and also the respiratory illness like chronic obstructive pulmonary disease, cardiovascular disease, etc. And now in urban area also pollution level has increased, which is a major threat for the non-communicable disease like the cardiovascular disease. So to prevent those things, we need to aware the peoples, we need to generate the evidence, and we need to guide to our policymakers. Like in later days, all the developing countries are facing the big problem. I'll say even the developed country from the climate change, and many infectious diseases were in the declining trend due to massive intervention efforts. But now, due to this climate change, the disease of the lowlands are now shifting towards the hill and mountains. So that is a big threat for a mountainous country like Nepal, and also other neighboring countries like India, China, or Bhutan, etc. So that means we are facing a new challenge, right? So to address this means we have to address the environmental risk factors. It may be climate change, it may be pollution, it may be waste management, it may be water pollution, or it may be any noise pollution, or maybe any radioactive substance. So for this, we need the interdisciplinary research. We need to involve the scientists who have a background from social science, natural science, health science, medical science, and we need to use the approach, holistic approach. Then only we can solve these national problem, regional problem, and the global health problems.
What are the challenges that you see for your country, and how do you see it related to the global community?
I was brought up in a rural Nepal, which is located around 1500 meters above the sea level. And I was born in 1981, that means almost 38 years back. And I was grown up till 8 years there. But even these 8 years, I see a lot of changes. And I visited later on and more changes. Like when I was grown up there, I used to drink any waters that was safe, no diarrhea. And at that time, there are no mosquito, right? But now people have to use the bed nets, otherwise they'll suffer from the disease like dengue or chikungunya or malaria. So in this way, the disease pattern has been changed. In that time, like the people were talking about non-communicable disease, these are the problem of the rich people, problem of the developed country. But now, in each family, there are the people of the non-communicable disease. I mean, maybe cancer, or maybe diabetes, or maybe respiratory illness, right? Or maybe suffering from the infectious disease, diarrhea, or cholera, or maybe suffering from the injuries or trauma. That means we are suffering from the triple burden of disease. And if you see the risk factor for this, then it comes in our environment. water is contaminated, air is polluted, and in the agriculture systems we are using massive use of pesticides, and so there is exposure to the pesticide, exposure to the pollutants, and then people are getting more and more disease. That means both infectious disease as well as non-infectious disease. So this thing get the challenge to my mind. Oh, why not to work on this? Where is the evidence? Most of the evidence come from Europe and America. But we as scientists from least developed country, developing country, we have to generate our own evidence. And we have to think globally, but we need to act locally. For this, we need the local level evidence. So that encouraged me to work on the issue like climate change and infectious disease, vector-borne disease. And luckily, I got an opportunity for my PhD to study in Germany under the DRD Fellowship, German Academic Exchange Services. And I completed my PhD in 2015 from Frankfurt am Main, Germany. And I went back to Nepal and I continued my job. Because before coming to Germany, I was in a position like the Nepal Health Research Officer and later on the Chief of Research Divisions. So this helped me to develop the networking at the national level, regional level and global level, and recognizing my contribution in the field of neglected tropical disease and climate change. The Senior Academy of Nepal, Nepal Academy of Science and Technology awarded me the Young Scientist Award in 2015, which also encouraged me to work further on this field. Right? And in 2017, I got a very prestigious Nepal Vidya Bhushan from the President of Nepal, and it is also a very prestigious award, and that also encouraged me to work in this field. And in the same year, the Global Young Academy approved my application based on my contribution in science and society as a member of Global Young Academy. And from 2018, my colleague appointed me as a chairperson of the Global Health Group. So repeatedly I am getting the achievements, and I am also contributing to the society. And like since last 2 years I am attending the World Health Summit. And not I am attending, but in Nepal also we are doing the National Summit of Health and Population Scientists, because we have to learn from the global community, but we have to apply. We have to bring a change in the national scenario. And now I am in the many higher level committee, steering committee, technical committee formed by Government of Nepal, where I can give a science advice. Where are the evidence? And we need to use the evidence for formulating our policy, plans and program, so that we can get a maximum benefit from our limited resources. That is my motto. And beside Nepal, I work regularly as a climate and health expert to the WHO, World Health Organizations, and I have already contributed in Maldives to develop their Health National Adaptation Plan, in East Timor, which is a small island country, to develop their Health National Adaptation Plan, and of my own country, where I started Health National Adaptation Plan to climate change, because we have to be prepared. And these are now not limited in the country. These assessments need to be done by each country, and it has been passed by the Mali Declaration, which was held in Mali 2017. Right? So these are the regional achievements. And beside that, based on my paper, like the United States CDC has also changed their travel notice regarding dengue, regarding Zika virus. Like they have advised the pregnant women not to travel up to 2000 meters where Zika virus is ongoing. And they made a decision based on one of the criteria was of my paper, which was published in PLOS Neglected Tropical Disease. So in this way, we can start from the local level, and those good practice can go in the regional level and also international level. So in this way, I'm just contributing to the global society, global citizens. As scientist of the least developed country, my motion is not to work only in a small country, but to contribute to the global society.
You work as an expert, bringing questions about health and environmental together. Was this a new approach for Nepal?
I did my graduation in 2004, and then I joined the Nepal Health Research Council, which is the apex body of the government of Nepal to promote health research in Nepal. And very rarely there are the positions in the health sectors with the background of the people of environment sectors. And the big challenge for me was that, okay, if I talk the issue of, let's say, air pollutions in the health sector, they say, oh, no, this is the issue of environmental sectors. If I talk the issue of, let's say, climate change, people say, no, this is the issue of the environmental sectors. We are the people of health sector. And I used to represent the health sector in the Ministry of Environment. And whenever I talk about health, okay, this is the development project, and when you do the environment impact assessment, we need to see health. Health of the people is very important. Let's say if you develop the hydropower dam, and it has a threat to the health because that became the breeding place of many disease vectors. They say, no, this is the environment sector. You don't need to talk about the health. The health sector will do. But if I see the disease burden of my own country, that means top diseases come usually diarrhea and respiratory illness. And their major risk factor is the environment factors, like solid biomass fuel, or the contaminated water, or the air pollutions. So until and unless we bring both sectors together, we cannot solve this issue. Like in the 1980s, the big problem of Nepal was like respiratory illness and diarrhea. And now after 30 years, after 40 years, again we are talking about the diarrhea control and respiratory illness. And this is not only the issue of my country, Nepal, of other developing countries, same scenario. The reason behind is that people have never utilized or never gave a big efforts to bring the two sectors together. I am happy that like many countries has already established the environment health divisions, but still my country no. Though we have a research cell, right? So we have to bring the both sectors together to address, that means to protect the health of the peoples. And I think the Lancet Commission has come up with a report in 2009, okay, climate change is the big threat of the 21st century. And later in 2015, they came again with another commission report that, okay, climate change is the biggest opportunity of 21st century, because we can take it as an opportunity because it's a threat. And we can address all these environmental factors like air pollution or the water pollutions, etc. And we can protect the health of the people. And this has given the opportunity especially for the least developed country who can access, who can request the adaptation fund from the developed country. And Green Climate Fund has already received big amount of money from the developed country, and it is a pool fund. So we can take an opportunity, and we need to work, and not only in a single country, in the global community. Even developed countries are equally affected. So our efforts should be for the reduction of mitigation of climate change as well as adaptation to climate change.
How did Nepal change during the last years?
Yes, recently we published a report, National Burden of Disease in Nepal, and this shows that we have a clear sense in trend of the disease in Nepal. Disease. And it shows that over the years we are very successful to reduce the child mortality rate, infant mortality rate, maternal mortality rate, and we have achieved almost all Millennium Development Goals. So Nepal was one of the unique countries to achieve most of the goals. Now it is a SDG era, and goal SDG thought talks about health and well-being. And if you see the changing pattern of disease, we are very much happy, means we have achieved we made a great achievement on infectious disease. Right? The threat now is the disease are now seen in the new area where they were not endemic in the past. So that is a big challenge. Though overall case load is reduced, but even the single case is a threat, so it is getting a challenge. And second, now more than 68% premature cause of death is due to non-communicable disease. And that means diabetes, chronic obstructive pulmonary disease, cardiovascular disease, chronic kidney disease, etc. So now our big challenge is how to combat these NCD epidemics. Though we have already made multi-sector NCD action plans, but we need to implement it effectively. And we had a quite tough time in the past because we are in the transition from monarchy system to the federal systems. So now we have a different 3 tiers government. So we need to make a new multi-sector NCD action plans, and we need to take the evidence we have generated by the scientists, and we need to make a evidence base. Then we can combat, means we can prevent and control the non-communicable disease in the futures. So for this, we need the investment in the adolescents, because if we do the investment right now, then we can control the NCs in the futures, because these are the chronic diseases. So in a nutshell, that means the big challenge for us now are the control of non-communicable disease, because that cover the major portion of burden of disease in Nepal. And equally important is how to sustain the achievement we have made in the past. Like we have a plan for the elimination of malaria by 2026. So we need to work further. We need to sustain those achievements, right? And we have elimination goals for eliminating the lymphatic filariasis and other disease. But they are now changing the pattern in the new area which were not endemic in the past. So we need to scale up our programs. We need to strengthen our surveillance programs. Then we can achieve our goal.
What would you like to change tomorrow if you had the possibility?
Yeah, first thing is that yes, it's actually a systems. No, we have to strengthen our governance system. We have to increase our transparency. And Nepal is a so kind country, I'll say. It has made a so kind constitution that it has a basic health, basic education, right to live in the healthy environment is a fundamental right of the citizens. So document is already very fine. Now we have to implement, and we are making hundreds of new laws. Right? We recently come up with the Public Health Act, and it has given also a mandate. Okay, if somebody gets ill because of the environmental factors, risk factor, he can complain, he can file a case, and he can get the compensations. Right? So it has a time now to change the country. So our Prime Minister has the vision, okay, prosperous Nepal and happy Nepali. So for this, actually, we need to all, and single person cannot make one change. We need the joint collective efforts, and for that we are working, and we have good economic growth right now, and we aim to bring the change in the country in at least in next decade. So for that, the scientists who are in abroad, who came abroad for study, I think they need to come back to the home country, and they need to serve the country. Then only education can bring the change in the life, not when the life of the people in the society and in the nation as a whole. So I actually request my all Nepali colleague and Nepali origin scientists to come back in the country and to work for the country, and we need to bring the change in the country. And if there is a change in the country, if we get graduate from developing to the developed country, then we also change our quality of life and image in the international arena.
What does the world need the most right now, in your opinion?
Most of the problem we can solve only through the networking and collaborations. So we need South-South collaboration, South-North collaboration, North-North collaboration, and ultimately we need to maintain the peace in the global community. So the next challenging thing is the international threat, crime, etc., right? Dispute. So first thing, we need to bring a peace in mind. You need to bring the peace in the society. We need to bring the peace in the community. That is a big challenge to achieve, but we have to achieve. Then only our humankind can sustain in this earth.
Do you have a dream?
So my dream is to serve to the global community. Living in my home country or living abroad, but to serve to the global community. My land, my mother, and the global community has given many things to me. So I need to give back. And that I can pay that debt only giving the service to them, giving the evidence to them. So my dream is to bring the health improvement in the people of the global community. Yes.
What kind of society do you dream of?
Yeah, prosperous society, and with the least disparity among the society members, because the big challenge of the global community now is the big disparity, economic disparity in terms of gender, in terms of economic status. So we need to narrow down this gap, because every citizen of this earth has the same right. But see, let's see, I have to talk, let's say in research, there are 90/10 gap. Like developed country has, let's say, 10% health problems, but 90% resource goes there. And developing country have the 90% health problems, but the resource is less than 10%. So there is a disparity in terms of resource allocations, in terms of education, everything. So we need to change this gap. We need to bring the change in this gap. So for this, I think we need the political reform. So it will be the political decision, not the scientific decisions. So every political people should have the enlightenment to bring the change in the global community, bridging the gap, right, and bringing down the disparity, right. I'll say it is a political issue, it is an economic issue. So I think we need again the holistic approach. Means scientists can give the evidence, but political people can make decisions, and we can achieve this.
The big question, but what is life about?
For me, life is to be balanced. To be balanced in terms of academic career, in terms of family life, and in terms of societal life. So if I'm very much expert only in academic life, that is not life, because I forget to live the family life. I need to balance with my family life, and I also need to give time to my society, otherwise society will not recognize me. So for me, balance is a critical word. Like the balanced diet, I have to make my life balanced for scientific community, society, and to also my family. So that is my motto, and I'm doing that. Like I got opportunity to do my PhD in Germany, and I came here, and I had small daughters, and in my society, especially like for female, its duties like giving childbirth and rearing. But I did not limit it to that, with the small kids and having another new kids. Even my wife also did her PhD, and I contributed a lot. And we went back to Nepal together with both PhD degree. And now we are working together, and one person take care of baby, another go to the conference, and another. In this way I am managing, and in the same time I am giving time to my family, like my mother, my society, my office. Like I can also stay in Europe longer. Right? But what I thought, I have to serve to my home country. So we went back.
Thank you so much for this conversation. And thank you all for watching, listening, and sharing. Keep wondering, and see you soon again. Bye and ciao.